Good afternoon, everyone. My name is Adam Del Molino, Senior Director of Virtual Care and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, How to Leverage the Health Sector to Connect Patients to the Affordable Connectivity Program and Close the Digital Divide. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2023 sponsors for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with leading experts to address timely issues like the one today. I'm pleased to introduce our presenter for today's webinar, Dr. Alistair Martin, MD. Dr. Martin is faculty at the MGH Center for Social Justice and Health Equity at Harvard Medical School and founder of Get Wavered, a campaign aimed at transforming EDs nationwide into the front door for recovery for patients with opioid addiction. Alistair previously served as chief resident at Massachusetts General Hospital. He now leverages his background in politics, healthcare policy, and the field of behavioral economics to use the ED as a place to build programs that serve the needs of vulnerable patients. He leads programs that transition homeless patients into permanent supportive housing, get patients struggling with addiction into recovery, and offer patients who are unregistered voters the opportunity to register to vote through a program called Vote ER. Thank you for being here today. Alistair, I'd like to hand it over to you.
Thank you so much, Adam, and thank you folks for joining and for being part of this, what hopefully is a vibrant conversation, an opportunity for us to not just talk about addressing the social determinants of health, but to concretely help our patients connect to a resource that can actually do something about them as well. Before I begin, though, I want to share with you a brief story to kind of get you a concrete idea of what we're dealing with in our emergency departments and clinics, like federally qualified health clinics and community health centers all across this country and all across Massachusetts. A couple months back, I was taking care of a young woman who was in her early 20s. She came to the ER with abdominal pain, and she was there with her elderly father. Her father had Parkinson's disease, and he was off in the corner, not saying much, but she was there for her abdominal pain. So, I got the history, and she wasn't very forthcoming with the history. It wasn't clear that she had anything like appendicitis or UTI or gallbladder infection, cholecystitis, and so when we as physicians, and for many of you who are on the line who are clinicians, know when you don't have all the information that you need from the history, what do? You kind of cast a wider net. And so we're all sitting there. I can remember us at the computer just sort of talking about our case, and none of us could really get a good story out of her, why she'd come in or what the historical features were for abdominal pain. So we're thinking, maybe this could be appendicitis, or, does she have a UTI? Is she pregnant? Turns out she was none of those things. Turns out when we got her labs back, she had something called starvation ketosis. You only get starvation ketosis when you haven't eaten. This woman had abdominal pain and was in the ER because she was hungry. I went back and talked to the patient, and I asked her, what's going on? We just got your labs back, and it looks like you're in this rare condition, which basically means, you haven't been getting adequate nutrition. She told me a story. She said, Doc, I'm embarrassed to say this, and I didn't want to say this, but my dad's medications for his Parkinson's, the copays have gone up. And at home, I've been making decisions around whether or not I'm going to take care of him and get his copays taken care of, or I'm going to eat. And that's the state of patients who we are seeing in the emergency departments and community health centers and FQHCs across this country. Our most vulnerable patients are living paycheck to paycheck. The core issue at hand, when we think about the social determinants of health, so many of the issues around access to things like telehealth, access to adequate housing, things like the ability to pay for your medication. So many of those things are linked back to, quite frankly, the toxic effects of poverty. And so if we're truly serious about addressing some of those issues, many of your hospitals are doing things like screening for the social determinants of health. What I'm here to tell you is it's time to move past screening. It's time for us to do something about what we do if the patient has screened positive for any of those social determinants of health issues. And luckily, the work that we're here to talk about today at Link Health is going to give you a couple of resources for funding that's out there to the tune of $80 billion in unspent federal aid program funding that could go towards helping patients just like the one I told you about, put a little bit more money in her pocket so that she doesn't have to make those excruciating decisions between taking care of herself and taking care of her dad's medications. Today, we're going to focus on one pocket of funding, and that's the Affordable Connectivity Program funding. But at the end of the day, if there's only one thing you take from this, it's this. So many of our patients, our vulnerable patients, have federal programs that they are eligible for. But the vast majority of them who are eligible either haven't signed up or don't know about these programs. And so I want you to think, what could your hospital, your organization, your clinic, your site be doing to connect these patients to these programs? Again, today we're going to focus on the ACP, but I want you to know about some of these other programs as well, because they can help your patients as well. But let's start first with the ACP. The ACP is a program that gives patients up to $460 a year. That's $30 a month payments for their internet bill. They also get $100 to put towards the purchase of their next computer, tablet, phone. And only a fraction of households that are eligible for this program have actually enrolled. Next is LIHEAP. This is the Low Income Home Energy Assistance Program. It's about $250 a month, and only about 20% of eligible households are enrolled in this program. ERAP is another program, a rental assistance program, and of course, many of you know about SNAP. Again, the same ingredients are true across all of these programs. There's federal funding available, and all of the patients that could be using this federal funding are not signed up. Many of those patients are in your waiting room. What Link Health does is figures out how can we connect patients to those federal funding sources right then and there. Let's now take a closer look at the ACP. So COVID dramatically increased the use of telehealth. I think we all know that through various mechanisms. The first is folks had limited access to healthcare facilities, and so they started to rely on telehealth more often. But also there were tremendous federal and state regulations that prompted the use of telehealth. It really sped us along the path that we were already on to a telehealth emboldened future. And so what we've seen now is basically those telehealth usage rates have not dropped down to pre-pandemic levels. They've hit a new set point, and that's a good thing. Telehealth is in general very good. The problem is, if we're not careful, telehealth has the potential to widen healthcare disparities. That's because in this country, we still have some 20% of Americans who lack broadband or high-speed internet connection. And those numbers worsen when you look at folks who are elderly and when you look at communities of color. And so that's where the ACP comes in. The ACP is a little-known program that was included in the bipartisan infrastructure law. It's $14.2 billion that's set basically to help individuals get access to the internet. There's a ride-along piece of funding called the BEAD program. That's $42 billion. And that's to help programs, organizations, hospitals, and other entities connect unserved and underserved communities to high-speed internet. So what is the ACP? The ACP gives households up to $75 a month. In fact, this started off as $30 a month for the vast majority of folks, but recently, about 2 months ago, a new provision was added to increase the eligibility for those who can qualify for $75 a month payment. So it's now not only just folks who live on tribal lands, but there are folks who are in high-need urban areas who also qualify for $75 a month payments. But the vast majority of people get the $30 a month payment. On top of that, folks get a one-time discount of $100 off their next connected device. How do you qualify? Well, for folks who are on this call, if you're in Massachusetts, your job is done. If somebody has Mass Health, they qualify. Our most vulnerable patients, most of them have Mass Health or Medicaid. And so if they have Mass Health, they automatically qualify for the ACP. The reason why this is important is because Link Health has spread all across the country, and some of our states, states like Texas, where we are actively organizing, folks don't have Medicaid because they did not expand Medicaid. And so it's really hard to actually get them to qualify. But we thankfully don't have that problem here in Massachusetts. And that is due to the incredible work that some of you have done here for decades to make sure that we are a state that now has access for all. So the problem is that although 40% of all US households are entitled to this ACP $30 a month payment, still only a fraction of folks have signed up. So look at the Medicaid numbers. Unfortunately, there's only a small fragment of folks who have Medicaid who have actually signed up for the ACP. It's a huge problem, right? And it's also a huge opportunity. You and I both know that just like that patient I told you about, most of our Medicaid patients would do well to have a little bit more breathing room financially, would do well to have that extra $30 or $75 a month, helping them to get access to the internet. Why? Well, because for that patient who's the 47-year-old guy with knee pain, who's coming off his construction worker site, instead of him coming to see me in the emergency department and having a $1,000 worth visit for an X-ray and some Tylenol, that patient could instead use the doc on call through your ACO or through the payer that takes care of them, reducing the cost of care. Now, if they have to come to the emergency department, we're happy to take them. But the bottom line is many of our patients don't even get access, don't have that option because they don't have internet. So what do we do at Link Health? It's very straightforward. We train community organizers to sign people up for the ACP, and then we deploy them to healthcare settings. Why healthcare settings? Because so many of our patients who qualify for the ACP, they're sitting right there in our waiting rooms. There are some 150 million Americans in total that would qualify for the ACP, and millions of patients have not been enrolled, and many of them are in your waiting rooms, in your community health centers, in your hospitals, and your private clinics. So in Boston, we launched this program about a year ago now, in partnership with Mass General Hospital, with East Boston Neighborhood Health Center, South End Community Health Center, and the Dimmock Community Health Center. We have several different approaches. The first is our active approach, and this is where we train pre-medical students, pre-nursing students, and even some residents, folks who are interested in health policy or community organizing, to go into community health centers and hospital waiting rooms and sign people up for the ACP. This is great for our pre-medical students. Many of them are looking for opportunities to be in clinical sites. It's great for our PA students because many of them need 150 hours of clinical exposure, and it gives them an opportunity to really walk the walk. Many of these folks are interested in advocacy, but they've never done anything in the advocacy space, and this gives them their first opportunity to get that work done. Our second approach is what we call passive approach. This is where we use posters and handouts, discharge paperwork that we deploy in a hospital to help them get their patients access to the ACP. Next, we have our digital approach. This is our SMS-based approach, where we have a community health center send text messages out to their patients, and then our digital navigators sign the patient up for the ACP remotely. And then lastly, we ride around in a mobile clinic called a MGH Community Caravan. So when folks are getting their blood pressure screened or their blood glucose screened, they can also begin the process of becoming enrolled in the ACP. So this is our first MHA advocacy opportunity. Link Health makes it super easy to get involved and to help your patients get the ACP using either the passive or digital approach. There are a couple of options here. I'm going to drop this link and you guys can take a look at that. And for instance, if you're in a hospital in Tewksbury and you want to figure out, well, how might we get some posters up for our patients at our site? We do that for you for free. Create those posters, and then we can get those sent to you and your hospital administration staff or whoever staff does that kind of thing in terms of getting communications out to your patients would work with us to get those pieces up. We also have a vibrant, we call them a little Link Health army of undergraduates, of pre-medical students, of medical students that we train to do ACP sign up. This is one example of that. This is not our passive approach. This is our active approach, where we actually have these folks in the waiting rooms doing the signups. This is just one example. Back on August 31st, we had about 60 pre-med students that we trained, partnered with the city of Boston, distributed a lot of money to families in need, and distributed 42 free laptops that day through a partnership with a really incredible organization called TEK Collaborative. This is another flag. Pause here. How might we partner to do a one-day event at your hospital or clinic, just like the one you saw? So are there opportunities to do work together and figure out if we can have our Link Health navigators do an event where we come by and do signups for folks in your waiting room? The whole goal of this is to really make it easy for patients, right? The idea is, how can we do 90% of the work, really get all the admin stuff taken care of, so the patient, all they have to do is confirm that the information is correct, and the application goes off and the patient gets the funding. This is just our preliminary data in Boston. We've screened thousands of patients for the ACP, and we've distributed over, at this point, $300,000 in total ACP funds. You can see here what you would have all predicted. The vast majority the majority of patients qualify for the ACP through Mass Health. After that is SNAP. The racial and ethnic demographics here are, the vast majority of folks are Hispanic and African American. We're really excited to have expanded our work. There's a lot more to come on that. We can't say much more, but we've got a really incredible opportunity to expand this work in a bunch of different areas. I've briefly mentioned the work we're doing in Houston, but we'll talk more about some of the work that's coming in Massachusetts very soon. We've gotten a lot of really great press. The Boston Globe did a nice story on our work. We have our preliminary data that's been published in the New England Journal of Medicine. And as I've mentioned, we are organizing in Houston as our second pilot city. And it got some really nice press and NBC talking about how students really are the backbone of this work, and how our next generation really is connecting these low-income families to these vital resources. So there's one more flag that I want to have all of us pay attention to and think through. The ACP is set to expire by mid to late 2024. Now, there are some other programs that are vital that can be used to replace the ACP, including the Lifeline program, which our team will be helping patients sign up for after this. But the bottom line is we really don't want the ACP to go away. So the question I want you to be thinking about is, how might your organization help push for the extension of this vital program? We've got a really incredible partnership with a number of different community health centers and hospitals and some ISPs to push for the advocacy piece of this and really make sure that the ACP doesn't go anywhere. So far, things have been off to a good start, but we need all the voices we can get, and having the voices of MHA and many of the hospitals that you all represent would be incredible to make sure that this vital resource does not get cut off. Let's put it this way. In Massachusetts, thousands and thousands of patients are currently relying on the ACP to have internet access. What if by next week, all of a sudden that funding dried up? Now you've got thousands of patients who no longer have access to the internet and can't engage in things like telehealth, can't engage in things like remote patient monitoring. Where are they going to go? Most of those patients are going to come see me in the emergency department. If your hospital is anything like my hospital, we've got boarding times that are astronomical. We've got emergency room censuses that are miles long. And at the end of the day, everything that we can do to help patients get care in the right setting is going to help move things forward. And so it's really going to be disastrous if we end up in a scenario where patients don't have internet access. So we really have to figure out ways to make our voices heard so the ACP does not go away. And so if you're interested in working with us on that, you can reach out to me directly. So the last thing I will say is we have an SMS-based benefits enrollment pilot. As you saw just a couple slides ago, we work with large institutions where we send text messages to their patients, and our navigators do the work of signing people up for the ACP. If you're interested in that, please let us know. We've got a pilot that we are currently enrolling sites for. Right now, we are doing ACP signups through that SMS-based pilot, but we probably, I would say in the next 4 to 6 months, we'll have the ability to sign people up for these other programs as well, to make sure that folks get access to these benefits. So if you're a hospital in Western Mass and you've got 70,000 patients in your hospital list, we can work with you to figure out how can we get as many of those 70,000 enrolled in the ACP, enrolled in LIHEAP, so that they get those benefits. And we've done that using our community health center partners, and now we're beginning to enroll pilot hospitals to do the same. So, yeah, this is our last flag. If you're interested in this pilot program, please reach out at the email below. So what are we going to do in terms of our next 5-year plan? The goal here is really to figure out how do we secure over $100 million in assistance for families nationwide. We've got, as Adam mentioned, a really vibrant program called Vote ER, which has 700 clinical sites across the country. We're using each of those clinical sites as the next jumping off point to bring Link Health. And so we'd love to have you included in that list and figure out ways to bring this $80 billion in unspent federal aid program funding into the pockets of your patients. With that, I'm going to pause, see if there are any questions, and we can take it from there.
Dr. Martin, thank you so much. Really appreciate it. Love learning more about all the different programs and the pilots that you're working on right now in particular, and understanding, all the great work that Link Health is doing right now. Quick question for you. How are hospitals like MGH currently using the Link Health programs to help their Medicaid patients access the ACP and close the digital divide?
Yeah, it's a really great question, and actually Rachel Pohl has asked another brilliant question, and I'll try and merge the two questions here and answer both. So our hospital, Mass General Hospital, has a really incredible Medicaid Navigator program. What that means basically is for our Medicaid patients, Mass General Hospital is involved in an ACO where we're looking for ways to increase the quality of care and reduce the cost of care by making sure patients end up in the right setting to get the care they need. So in our ER, we have Medicaid navigators who will often sit with a patient and identify resources like housing or food resources that patients can use. What we do with the Medicaid navigators is the navigator will sign the patient up for a referral for our Link Health navigators to then complete the ACP application. So if I'm seeing Adam and I'm the Medicaid navigator, I'll begin the application for Adam for the ACP. It takes about 30 seconds. That creates a ticket for our Medicaid, for our Link Health navigators. And then the Link Health navigator will complete the sign up and then complete the enrollment so that Adam gets the ACP funding, hopefully in the next month or so. So that's how we currently operate. So it's basically a way of augmenting the workforce and not adding more to the plate of the folks who are on the ground, but giving them an extra set of digital hands. And that's often, Rachel, what we see when it comes to getting buy-in is how can you carry out these interventions and these pilots in a way that solves the problem of the partnering hospital. So.
Great, thank you. And if folks have any other questions they'd like to enter in the chat, please let us know. Another question that's come in, Dr. Martin, is what do you think are the implications? We talk about cost savings and the increased quality of care for hospitals that enroll their patients in the ACP.
Yeah, the ACP is a tremendous benefit. I mean, here's one thing that we know. When we take a look at patients who have access to high-speed broadband internet, a couple of things happen when you compare them to folks who don't. Number one, chronic diseases get better. It turns out that the simple act of making sure someone has high-speed broadband internet means that they now have the ability to communicate with their doctors, to get those prescriptions refilled, to learn about their disease process. And for every single one of our major chronic diseases, obesity, diabetes, hypertension, the incidence rate of all of those diseases falls when you look at patients who have access to high-speed or broadband internet as compared to those who don't. The second thing is we know that doing that by getting somebody online, you're giving them more options in terms of ways to take care of themselves. And as we mentioned in a couple of the vignettes, patients now have the ability to, instead of going to the ER and getting that costly visit, they can now see somebody on virtual or remote settings. So there's not only a cost savings to this, but there's a benefit to the chronic diseases that patients have that they struggle to take care of. So this is a win-win. It's a win for the patients. They get extra money in their pocket. It's a win for the hospitals. We've got a way to reduce unnecessary visits. And for those of you who are in shared savings or ACO or risk-bearing contracts, reduce the cost of care, but it also gives the patient another opportunity to get the care they need in a setting that works for them. So back to you, Adam.
No, thank you so much, Dr. Martin. And I know that we're coming up on time right now because it's 12:30, but just wanted to sit there and say we look forward to joining with you in advocating in support of the expansion and the, I guess, the continuation of the funding for the ACP with the administration and having those conversations. So We'll be in touch for sure about that. I can guarantee you that one. And we look forward to actually joining you in all the initiatives that you kind of outlined and promoting those further. So just want to thank you for joining us today and making this presentation with regards to all the great work that you're doing. And for our members here joining us on today's call, thank you all for joining us. You can scan the QR code on your screen now, I think, if we have it, so that you can see further educational programming from MHA if we've shared it already. And we have a number of events this coming up in this winter, and we hope to see you all again very soon, including our Women Supporting Women event that's coming up on December 7th at the West End Waltham. So thank you all. Have a wonderful afternoon, and thank you, Dr. Martin, once again. We really appreciate everyone joining us. Thank you.
Thank you so much, y'all.